Hi, my name is Emily Small. I'm going to be doing a head-to-toe assessment on a mannequin as my makeup clinical for week 1. So first things first.
For the iodine, right? From remember.
Hi, makeup.
Yeah. You have to open the.
Hi, my name is Emma. I'm going to be your nurse for today. I'm here to do a head-to-toe assessment on you. Should take around 5 to 10 minutes. Is now a good time? Patient's
Everything is sterile.
I'm going to verify their name and date of birth by looking at their medical ID band. Name, correct date of birth, correct amount. Beautiful. Before we begin, how are you feeling today? Patient says that they're feeling okay given the circumstances. Patient looks to be the appropriate age. Skin matches the ethnicity that the patient has provided. They are dressed appropriately for the weather because it's raining outside. The patient looks to be pretty high spirits given the circumstances, which is appropriate. They don't seem to have any physical deformities from what I'm viewing. And they look like they are appropriately dressed to be in the hospital.
So if you are
Carrying on to that. Do you know where you're at? Patient states Chicago, Illinois. Patient's able to give me their correct year. Patient is also able to say, read my shirt. This is Northwestern Medicine. And do you know your last name? Patient is able to give me my last name. Patient is ANO times 4. They don't seem to be having any hearing difficulty or sight difficulty either. Wonderful. Moving on, I'm going to go ahead and start my physical assessment. Patient, looking at the patient's arms bilaterally. Arms are match the ethnicity that the patient is given. Tell the patient hold their arms out like that usually. Patient looks like there's no wounds, incisions, no scarring, no tattoos. Skin seems to be even texture throughout. I'm going to go ahead and palpate using the dorsal side of my hands. Dorsal side of my hands, skin is warm to touch, dry but not too concerning. And again, it feels very even. Skin also seems to be intact throughout. I'm going to go ahead and check my patient's skin turgor. Skin recoils in under 3 seconds, normal finding. I'm going to check the capillary refill. Capillary refill under 3 seconds, which would be considered a normal finding. Wonderful. Moving on to my patient's head. Patient seems to have no cephalic. They seem to have good hygiene. Hair looks to be very clean. No lice, incisions, wound infestations noted. I'm going to go ahead and look at my patient's face. No tattoos. Skin also matches ethnicity. No marks, bumps, bruises, tattoos, or anything like that. Looking at the patient's ears as well. Might as well just my assessment. Ears look to be clean. Ears seem to be normal size bilaterally. No incisions, wounds. No piercings as well. And I'll go ahead and palpate that later. Looking at the patient's nose. Nose looks to be symmetrical with the rest of the patient's face as well. Patient's nose seems to be no incisions, cuts, or wounds. No drainage noted or anything like that. So I'm going to go ahead and palpate my head. Normal cephalic. Looking at my patient's eyelashes, eyebrows, and eyes. Eyes are bilateral. Eyebrows also bilateral. Eyelashes also bilateral. No infestations noted. Flakiness noted. No redness, marks, or bruises noted. So looking at me pretending like I have a pen plate. I think I actually have one. I always have one when I don't need it. Here we go. Patient's pupils are even. Pupils are even, equal, reactive to light. And then I'm going to go ahead and look my finger for me. They are also accommodating as well. Perla is intact. Eyes cornea and subjectiva, both look normal, wonderful, and all that. Going on into my ears. Ears, I'm gonna go, I already assessed it, inspected it, so now I'm gonna go ahead and palpate it. Palpating, do you feel any tenderness? Patient states no, no tenderness noted. Uniform, no inflammation noted. Go on the other side. How does that feel? Okay. Patient says yes, no tenderness. Wonderful. Going on ahead. No skin breakdown bilaterally either. I forgot to mention that
So
earlier.
never pull it down.
Oh, right. Now we're going to go down to the nose. I re-inspected the nose. I'm going to go ahead and go internally. Nose looks to be no mucus noted, no boogers clogging up his nose. I'm going to go ahead and test his bilateral patency. Tonight's to be hands-on right now. And then do the other side. Patient's able to do bilateral patency, which is good. I'm gonna go ahead and assess my patient's mouth. It looks to be pink. No lesions noted, infestations noted, no bumps, bruises. Do you want to go ahead and say ah for me? Patient says ah. Uvula rises in the back. No pooling of the saliva. Your nose, line, and antenna are intact. Patient's teeth are white and straight. The gums are pink, moist, and intact. All his mucosa looks pink, moist, and intact. Tongue looks pink, moist, and intact. Tongue pad looks to be pink with some gray undertones, moist and intact. And then the soft palate also looks to be yellow and pink with some gray undertones, moist and intact. Wonderful. I'm gonna go ahead. I'm gonna put that down. I need to auscultate a little bit, so I don't know how to lift the sky up, but I would do the posterior lung sounds. As such, I'll do them on myself. Oh, I can't really do them myself. But pretend this is my patient right here. I could do left upper lobe. Oh, give me 1 second. I would do left upper lobe, right upper lobe. Left upper lobe, right upper lobe, left upper lobe, right middle lobe, left lower lobe, right middle lobe, left lower lobe, to the side, right lower lobe, left lower lobe again, right lower lobe, to the side, right clear and vesicular lung sounds right out. Before I would do that, I would obviously inspect my patient's back first, but because I can't do that, I'm going to go ahead and assume that is pretty good. And then anterior lung sounds, I'm just going to go ahead and do that up here. Right upper lobe, left upper lobe, right upper lobe again, left upper lobe, right again, left upper lobe.
Okay, let's see it.
Left upper lobe, left upper lobe, right lower lobe, left lower lobe, right lower lobe to the side, left lower lobe, and vesicular lung sides are heard throughout, especially on the anterior side. Okay, cool. So moving on to my cardiac respiratory system assessment, I would palpate the pulses first. So I could do his temporal pulse, his carotid pulse. I would only do one side though. So I go ahead and palpate the carotid pulse for 30 seconds if normal. If abnormal, I would do 60 seconds. Palpating. Regular rate, regular rhythm, 2+ for his carotid. I could also do bilaterally brachial pulse, radial pulse, ulnar pulse. I could go down and do the popliteal. I could do his posterior tibial pulse, and then the dorsalis pedis pulse as well if I want to. Oh, I could also do his femoral pulse as well. I don't need to do that because I already did his. Pretend like I already did it. 2+ regular rate, regular rhythm. Wonderful. Moving on. We are going to go ahead and do your cardiac assessment. So, cardiac assessment. I'm going to pretend like I actually have my stethoscope in because I have my headphones in. Aorta. Hold on. Hertz point. Tricuspid and mitral, and I would use that was with the diaphragm. I'm going to go ahead and use the L side. S1 and S2 noted. regular rhythm. No murmurs heard, no S3 and S4 noted either. So using the bell side. And do the same order aortic. No murmurs noted throughout. I might as well just go ahead and assess the groove for any groovies. So I'm going to go ahead and look out my stethoscope and auscultate its carotid artery again. Alright, no groovies noted. Wonderful. Moving on, I'm going to go ahead and assess the, I'm going to lay it back a little bit. Ooh, whoops. Now you're okay, well, it's taking forever. I'm going to go ahead and I'm going to be inspecting your abdomen. Do you mind if I lift up your shirt? Patient says yes, no problem. So I'm going to go ahead and lift up the shirt. Okay, we're going to pretend like this is normal, but I'm going to go ahead and inspect the abdomen. The skin looks to be dry, intact, no incisions, wounds, no, nothing too concerning. The circumference,
So the condom you just put in here.
everything looks to be symmetrical, as belly is symmetrical, as your patient's pretty symmetrical as well. No pulsations noted. Anything like that. I saw this chart. He ate a few hours ago, so I might be hearing some ball sounds, hopefully. Alright, so I'm going to go ahead. Do you mind if I just inspect your stomach? I'm sorry, it's a little uncomfortable. So I'm going to go ahead and auscultate. And I'm going to start first with the right lower quadrant. I'll listen in 3 different little spaces. Right upper quadrant. Left upper quadrant, left lower quadrant. Oh, my reality. Alright, and then active bowel, hyperactive bowel sounds heard throughout, which is a normal finding, especially because it eats. Wonderful. So next, what I'm going to do is percuss. I'm going to go in the same motion again. Alright, temperature heard throughout. Wonderful. I'm going to go and palpate. Normally we do a light palpation, deep palpation. For the sake of time purposes, I'm going to do a light palpation. So, let me know if you feel any tenderness. No rigidity noted. Patient does not seem to be guarding. I'm feeling for the muscular walls and everything. Nothing feels concerning. Everything's nice and squishy. Alright, beautiful. Wonderful abdominal assessment. Alright, I'm going to ask my patient quickly, do you mind remembering these 3 words for me? Dog, cat, bird. I'm going to ask you them again later, so remember dog, cat, and bird. Alright, so I'm going to go ahead and assess the cranial nerve. So the patient is already able to see perfectly, the pearl is intact, the cranial nerves 3, 4, and 6 are intact. The patient is also able to hear me, so I need my headphones.